Johesu,
following
this,
that's joint health.
Yes, following this their meeting with the Secretary of Federation, now signs an agreement. Now signs an agreement to reverse that same thing you agree with the NMA.
Is that not balancing? I don't know.
You don't get it.
Don't you think that government was going to balance across board?
You have signed an agreement with me that yes, indeed, it is already operational. You're already appointing deputy CMAX, right? And then Johesu goes and says, look, we don't want you to do this. We don't want deputy CMAX again. And then you sign that agreement with them. What does it mean? What it means is posturing. What it means is that it is obvious that those things that you have promised me, which I have been patiently waiting for, you are not going to get it done.
Mr. Taufik,
then besides that, you see something.
You're not happy with the doctors. You're not happy with the doctors.
There's something that's so important.
I'm not angry with doctors. I'm not angry with doctors.
But you're not happy with their decisions.
Now, being happy with their decision is not.
You're not comfortable with their decisions.
Yes.
And if you're not comfortable, what will make you comfortable?
We're looking at it like this. He said something, and we must get it straight. Peradventure, I fall ill. I go to Mr. Taufik.
Couldn't that be effects? Those are more of effects.
You know?
I'm just thinking effects.
You know?
Well, before that.
Do you understand?
Well, before you fall ill, I mean, the process, don't you think the processes, things should go right?
Beautiful.
I'm just
very beautiful. That is going to bring us to a point. That is going to bring us to a point. See, we are jumping. Let's jump this step. Right? That is going to bring us to a point here.
What point?
He said something. You falling sick. You falling sick. Do you agree? Do you agree that certain things are supposed to be there in the first place, preventing you from getting sick? In the first place.
No, can I answer
you see,
that?
Our professional
Okay, let's see. You may have a magic wand. Let's see. Throw it in.
Everybody falls sick.
No doubt. But you just go wait and let everybody fall sick.
Goodluck Jonathan.
We don't want an Ebola.
Wait, so you understand where I'm going.
Taufik, listen.
Do you fall sick or not?
Do you fall sick or not? Do you fall sick or not? Do you fall sick or not? Do you fall sick or not?
Which
do you fall sick?
The NMA has been pushing in the last 3 years.
Do you fall sick?
Because of this same professional territorial protection, which members of this Johesu have been up to in the last 2 years, they have refused this health bill to be passed.
Why? Why?
Can
you tell us?
I don't know. Your guess is as good as mine.
No, can you tell us why?
Your guess is as good as mine. I've said it. I say it is professional.
What do you sense? What are you sensing?
You know what I sense?
You know one of the contents of that health bill. One of the contents of that health bill.
Let's say what you're sensing.
Is to ensure that the local health, they are funded directly from the revenue.
Okay, hold it up. On funding, health funding. Hold it on health funding. Okay, so you tell me what you think should have been. How should it have come?
Now this is it. I agree to the fact that when you're pushed to the wall, you take some very, decisive.
So there's a pushing.
There's a pushing, and there's
somebody's got his back against the wall. Do you agree up to that point?
I mean, absolutely.
Okay.
Absolutely. Okay. Now this is what we're saying, that at this point, we are not looking at the benefit. This is the federal government. This is NMA.
Some graphics guy going on.
Right?
Sorry if you can't see the graphics. We'll illustrate that.
Yes.
Don't worry. This is it. He's trying to give us some graphics.
This is it. This is the government. We're looking at strategy now. The government, NMA, this is Nigerians. Right? The government is trying to fix this. NMA is trying to fix this. Right? They're all working.
The people in the middle, government to the left, NMA to the right. That's what the graphics.
Everybody's trying to do that.
Government wants to fix the people. NMA wants to fix the people.
Now, NMA says, government, we need 5. Government is saying, okay, for now, I don't know what the government is saying they can do, but NMA is saying that, hold on.
Something is so obvious what you have said.
Hold on.
Can you just hold on? Let's just hear the analysis.
You've got to hold on.
Let's just hear his analysis. Let's just hear the analysis. No, can we just, please,
I'm looking at it from my own perspective.
Yes, let's hear.
Your perspective must actually be in tune with the issues.
Let him learn. I will align everything. I will align all your thoughts. Hold on. Mr. Taufik, I will align all your thoughts.
NMA is calling an indefinite strike.
Okay.
From what they have told Nigerians.
Yes.
You are the one on this program that has said it's a 20-year-long
I said
battle.
Some of the issues
okay, now hold on.
have been on
okay,
for
fine.
20 years.
Thank you for that. Can you hold it there? Now, what the other guy in the street who is suffering from this pain knows from what he has read, what he has seen, what even Dr. Kayode Obembe has said, is the fact that we have given the government 2 weeks ultimatum and they have not met it. And we've given them 24 endpoints that they need to meet.
You see,
there are endpoints where they say, now, What
you're
we're
a human
simply
resource
saying is
person,
that,
but you should
listen,
understand how labor matter works.
Mr. No,
You do not just wake up and give a government
I'm gonna give him.
There must
Hold
have
on.
been
Hold
other
on.
things preceding
Hold on. Yeah.
that.
Hold on.
I'm talking
It is
about
at the
on that
point
point
where
reporting
they are
what you
getting
guys
to the
have
break
done.
that you then give that ultimatum.
I'm going to give you all the time. I'm going to give you all the time.
Mr.
But for
Taufik.
while it's getting heated up, viewers, we will come back shortly and get this discussion going forward.
Okay.
The health matters in Nigeria. The Nigerian Medical Association have decided to down tool. Join us. We started by saying that we are aware and acknowledge the fact that we have a lot of Nigerians out there who can get medical treatment right now in public institutions, and that's because some folks within the contraption or the association called Nigerian Medical Association say that government is not listening to them, and they've decided to look the other way as far as administering health provisions are concerned. I have two guests. One is a medical doctor. His name is Dr. Taufik. And I have somebody who is very sympathetic with human beings, and he's here also to talk about why this could be suspended for later. Gentlemen, before we went off on break, you were talking about the government and NMA trying to fix the same problem, which is the health sector.
Absolutely.
Perhaps, maybe there's a loose end somewhere, and it's a case of allow me to do it professionally or allow me to spend the money to do it. Is that what the problem is here?
That's basically just looking at the face level. What NMA is asking for, if you take a look at the 24 points they're raising.
Even if we don't have to, even if government doesn't have to, I'm not preempting them, but if government doesn't have, if they don't want government to meet all the 24, if we take, say, the first 5, are there any moral justifications for the things they're asking for?
Okay, great. I mean, for people to ask for something as a profession, as a professional group,
yes,
being moral how am I going to say it now? There are a lot of variables.
Okay, are their demands
moral? Yeah, I mean,
their demands, are they succinct?
Now, let me read some of the points.
Okay.
Right? Their grievances are, they want increase in allowances, right? From, they want, I think currently the hazard allowance that they get is 5,000, and they want it increased to 100,000. Now, because I actually deal with issues that concern national development economy, and you're looking at GDP and sustainable development, can this present administration, or not even administration, can we as a country at this point, looking at the numbers of doctors that we have on the payroll of government, can the government afford that? That's the question. That's one.
Let me just take you on that.
Appointment and titles
so you don't
and
go
position.
Too far.
No.
You see, let me just take you on that.
We said we're going to
something
do
is obvious. Hold on. Something is obvious that you are not really familiar with this.
Can you just finish on the second point?
Can I finish on the second point?
Just the second point, then you can respond to that.
And the grievance